All right, let's dive right into chronic pain, okay? And let's talk about why it's such an epidemic and what can be done about it and just all the ins and outs. Now, it's a huge topic, so this is just one video, one layer, but hopefully this unlocks a few ideas to help you, okay? So one of the biggest things that we're going to talk about right now is the conventional medical answer to chronic pain and why it's, there's a place for it, but why it really ultimately fails to really help relieve the true underlying causes, the root cause, and help you lead a better life, okay? Hi, I'm Dr. Jason McCammon, board certified naturopathic doctor. I have training in many functional areas of medicine, including physical medicine. And by the way, I'm a chronic pain survivor myself, so I've literally lived this for many years, so I know what you're going through. It's difficult. So let's get into what's broken, first of all, about the chronic pain system and some of the things that it can cause. First of all, depression is big. Whenever you have pain in the body, you get what's called nociception. These are when the nerves send signals to our brain that we're not okay, and that really messes with our brain centers that help us with mood and it tells us everything's okay. When you have pain, our brain tells us we're not okay. So it really is a big contributing factor to depression, weight gain as well. And why? Well, because you're not as active in doing things. You're more cautious to do things. You don't move as much, so maybe more weight gain there. And also, when you're depressed, you might eat maybe more comfort foods, right? Loss of sleep is big. Without sleep is such a huge tenet, guys. You got to be able to sleep really good to really have good health. And if you're tossing and turning, or if you have just so much pain, you just can't even get comfortable at night, it's going to be hard to be healthy when you have loss of sleep there. Reduced wages, people don't realize this, but it can cost you a lot over the long term with your career because, again, not being able to focus as much because of your pain, medical appointments, maybe things that drugs or other lifestyle factors with managing the pain that cause you to not be able to maybe put the type of quality into your work that you'd like to, maybe not as with being able to show up with this amazing attitude can reduce your risk or your rate of which you might get a promotion. So it can really affect wages there, not to mention time off work. Now our conventional medical system does really good. It's got amazing training when it comes to acute pain. If you just tweaked an ankle or a knee, maybe a son or daughter, spouse, in a car accident or something like that, it's really incredible when with the amount of medicine and techniques and the emergency department physicians. I've had clients that are in the ER department, they're incredible skill set, and they're really good at taking care of that up front with the drugs and the procedures, all the surgeries with the hardware they put in. Some of the stuff is really amazing. The problem is with the chronic pain, and that's what most people deal with, not acute pain. That's where they don't have as much training, in my opinion, and I've seen a lot of times some poor outcomes there. So I definitely want to show you the contrast there. So there's what medicine also often refers to treatment. Okay, they keep saying that word treatment. When we look at treatment, what does that really mean? It really means you have a achy knee and we're going to treat the knee. Does that make sense? We're going to treat it. So if we just look at the knee as an isolated joint, there's only so much we can do, okay? If it truly has a pathology such as a torn meniscus or an ACL, yes, you probably should get that looked at, and if it requires surgery, so be it. But often, I don't know if you know this, but the knee joint is simply what I call the canary in the mine, okay? It really excuse me, it really reacts to what's going on at the ankle, foot, and then at the hip level. And if you're not addressing those things at the ankle or the hip, then the knee is going to suffer. Okay, it's more of a reactionary joint. It's also what's called a joint of it needs a lot of stability, where the ankle and hip typically need what's called mobility. We'll get to that in a little bit, but there's one example for you where you can't just stare at the knee joint and say, hey, this thing hurts, fix me, doc. There's more to it than that. Okay, especially when it comes to chronic pain. We've got nociception we talked about a little bit earlier, that it sends those pain signals back to the brain that something is wrong. What it does, the longer you're in pain, the more those signals from the brain, again, in this case down to the knee, it constantly sends those, and the more likely it is to keep sending them, the more you have that pain nagging you, okay? Inflammation is big as well. We think of inflammation as like, man, I hate inflammation because it causes pain. Well, actually, inflammation is a good thing. It's our body saying something is wrong. We need to attend to it. So at first it's helpful, but long-term inflammation, really wears us down. It can cause atrophy of the muscles and cause a lot of problems long-term. Now, if you've tried physical therapy, injections, procedures, and trial and error with different doctors and this and that, one reason it's probably not going well is because it's possible, and again, in my clinical experience, I get lots of clients that have already been through all that, you don't have a professional or clinician addressing the root cause and looking at your body globally. Again, just like the knee we talked about, let's assess every body part and help the entire body work better. That's going to help that region work better. That's what we're missing a lot of times in this chronic pain type situation. It's really a holistic approach to this, okay? Let's talk about for a second chiropractic and osteopathic care. Big fan of those practitioners there. We've got family chiropractors. I know osteopaths. Had some great training by some osteopaths. I think it's great medicine, right? The issue I have with both concepts, though, in general, is that it's very good at treating, again, a subluxation, which is when a joint is out of balance. That does cause inflammation and pain. It can, for sure. It's great at that. The problem is I see with that system, though, I just not have seen, and for most of those clinicians that practice that, a lot of follow-up care. I just haven't seen them really follow up and say, you know what, let's look at that ankle, that knee, that back, your breathing pattern, and let's look at a program to look at those other global factors, again, holistically, and see what we can do to help less force end up at that knee joint. Again, I keep beating on the knee, but I just want to give you that an example where if we can look at these other things, you'll have less forces being sent to the knee. Therefore, the knee has to do less, needs less stability. It can start to heal. It has less friction, for example. And so, again, is there a place for those practitioners? Absolutely. I still refer out to chiropractic care for, really significant spinal issues for sure. Osteopaths, if somebody's dealing with some really big acute pain, especially from a car accident, once we're out of the woods as far as like the emergency department, definitely see an osteopath for a little while to, when you're dealing with things where you can barely move, or physical therapists. Again, I know some, a couple good physical therapists as well. But again, on the front end, that can really help. Long term, though, are we really looking at the entire picture and helping you heal in all these areas? Okay, we're going to expand upon that more and help you understand why holistic approach is going to be more successful long term, although it may take longer, but it's more permanent. So acupuncture is a whole nother video, really, in a subject. However, lots of studies showing it's very helpful for chronic pain, because why? It helps energy flow through our body. It's really energy at the nano level, okay, quantum energy, but nonetheless we need energy flow in the body, so that can be very successful. But again, is it long term actually fixing the movement flaws that we have? No, but it can help, and it's also a non-invasive method. Medications there, of course, we all know about the opiate epidemic. That's such a huge portion of that is caused by chronic pain. So I would definitely encourage you to try to minimize those, or look for alternatives, even if you had to just replace it with like a THC. I'm not saying that's the best answer for everything, but it certainly can help a lot, and it's a lot safer than an opioid. But however, if we need to use those, there is a place for those when people have severe pain, because you got to get through the day. NSAIDs can really affect the body. Non-steroidal anti-inflammatory drugs, things like an ibuprofen, those types of things, naproxen. Again, they have their place. They can be very helpful, but they can do a lot of damage to kidneys and liver over the long haul. And they also can destroy our gut lining, which leads to, guess what, more inflammation, and guess what, more pain. So we have to be careful with those. So let's talk a little bit about what we can do about that. First of all, I want to make sure we delineate chronic pain is, what I'm talking about today is in the body, more muscle and joint. And there's, there's chronic pain with neuropathy, for example, which is just, nerves get damaged from, for example, high blood sugar, migraine, autoimmune conditions. There's lots of different types of chronic pain here, guys. And I'm not saying the approaches I'm going to go over in a minute may not help those. They could, but we're talking about muscle and joint related pain in this particular video. So first things you can do is look at low inflammatory foods. Now, everybody is so unique. Man, every client I've seen over the last 20 years, been doing this a long time, seen thousands of clients. Everybody is unique, truly. Having said that, in order for just to start somewhere, and unless you want to work with a clinician, I would recommend something like the Mediterranean diet. Of course, you have to pay attention to food sensitivities and gut health and all that. It's really important. But if we could, put into a nutshell, Mediterranean diet has been shown to have a reduced inflammatory load in the body. Also, I'd reduce your omega-6s. This isn't talked about a lot. You have this omega-6 to 3 ratio, and the science has shown when it's tilted higher toward omega-3, like more of a 4 to 1. So that means, 4 parts of omega-6 to 1 part omega-3. We're going to get less inflammation in the body. That's big. It changes literally what genes we express, because it changes your epigenome on top of those genes, okay? And the higher omega-6 sources, for example, all your like soybean oils and your margarines and things like that, a lot of animal fats, they're going to raise inflammation. Not necessarily that are all those foods bad, but they just change that inflammatory ratio in your body. Okay. Another thing we can do is stay hydrated. And of course, you can never go wrong with getting hydrated. Distilled water is big. It definitely helps carry minerals better into the cell. It helps carry waste out of the cell a lot better than any other type of water. Supplements. Turmeric, I just listened to a podcast by this really elite expert on inflammation, and turmeric, she was saying, is just unbelievable. And I knew that, but hey, I'd like to reinforce that the research backs it up. It's really big. Turmeric, make sure you have a little black pepper in there as an extract, or you can add it, like if you're going to put turmeric in a shake or smoothie or something, or a recipe. Ginger's big, anti-inflammatory. Cayenne can be helpful as well, and you can get cayenne that has that capsaicin kind of like lowered a little bit, so it's not so hot. And we talked about omega-3 fatty acids already, like a fish oil. Really important. By the way, your fish oil should be triglyceride form, okay, or phospholipid, not ethyl ester. Most are ethyl ester. Let's talk about movement. Chronic pain, it can be tough because you're like, man, should I do this? Should I not do this? I'm afraid to get injured. You don't want more pain. I get it. But it's actually always better to start with a little bit of movement, okay, and just assess it from there. Use pain as your guide. But introducing a little bit of friction to especially a muscle belly. And what I mean by that, you have, two joints, right? Let's say ankle over here, knee, and between them, right? We've got the knee joint in the center there. So we've got thigh musculature and then calf musculature, right? Between those joints there. So I'm talking about the muscle bellies in between the joint. We can introduce a little bit of friction there. So self-massage is really big. We could be looking at a massage gun. You probably seen those around. Start with a low intensity and just get a little movement in there. Just get some blood flow going in there. Take it easy, low setting at first. Foam rolling can be very helpful. Although I found you have to be able to typically get a lot of pressure on it. So getting on the ground or on the floor might not be realistic. But if you can, if you're able to get on the floor and get some, for example, get the quad muscle, get on top of a foam roller, that can help a lot. A massage stick. They have the handle look like handlebars here, right? Got a massage stick, got little beads in the middle. That can be helpful as well. They also have things like tiger tails. The crossballs is big. That's just an oldie but goodie there. Just pretty much any round object. I especially like the little therapy balls that have got a ball and it's got little spikes all around it. Those are really cool. And then I've been known to grab dog chew toys, honestly. So I'll just grab whatever, as long as I can get some pressure there. The idea is to, again, move the tissues around, and what we're looking for is a lot of our tissues in chronic pain are glued together, called myofascial adhesions, okay? And they're just locked together. What that means, if that muscle belly won't glide, the ends of that muscle system, which is, again, is the joint, that's where we feel a lot of pain, okay? But we have to actually unlock the middle of that muscle to allow what's called sliding surfaces, okay? We gotta allow these sliding surfaces. And it's analogous to if you had a bed and you're making up a bed, you've got, a couple layers of sheets on the bed, and when there's nothing on top of them, they can glide over each other just fine as you move the covers around. But if we put an object, let's say, we put a brick on there or even sit on it, we create this crazy friction and they can't move very well. They're very stuck. If you ever had that, maybe a couple kids are laying on the bed, you're like, hey, get off there, and you try to move it. That sheet isn't going anywhere. It's just a sheet, right? Well, that friction increased in there. That's what happens in our muscle bellies. So we have ways we can unlock that, and we start with these self-massage tools. Really, really, really helpful, okay? I want to point out that working at the joint, as far as on your own, probably not a great idea. You got to be really careful manipulating and working on tissues of the joint. Wrapping them would be good if you could wrap them up. Sleeves, joint sleeves, things like that. Ace bandages can be good, but I would not put a lot of pressure at the joint tissues unless you've been given, instruction by a practitioner. But again, muscle bellies, the soft tissue we want to focus on at this point. You also have what's called phasic versus hypertonic muscles. Phasic just means muscles that are just completely shut down, do almost nothing when they should, turn on. And hypertonic muscles meaning that they're overactive. So what happens is we have if you imagine a tug of war, we have a big strong person at this end and a weak person at that end, you're always going to get tugged one direction, right? Or they're teeter-totter. Remember that? They remove those from the playgrounds, but we have a fulcrum here, and then our bar up top and the two seats, and then the thing, moves whichever who has more force, right? I want you to think of that when it comes to the joints, okay? The joints have to have equal forces going through them, plus and minus, or they're going to get injured, or at least raise risk of injury. So let's talk about that. phasic muscles versus the hypertonic, right? If we go joint by joint approach, again, this is general, okay? Everybody's different, but this is what I found in my practice to really unlock the body. I've seen tremendous outcomes, like crazy outcomes. I've seen people that can't even get out of their car, like win their golf league after a few months of working with me and applying these principles at home. So let's talk about that. Generally speaking, again, for this purpose of this video, give you some insight there. You really want to mobilize the following joints. Ankle, which means we need more dorsiflexion for that knee to travel over that toe. The hips, especially hip flexors, right? We sit a lot in our culture. So our hips, are always at 90 degrees, right? Here's our back and here's our femur bone there. If we're always at 90, we go to stand up, they want to stay stuck. Our brain thinks our hip flexors are still in a seated position. Okay, let's mobilize those. The T-spine, which is going to be, you have your neck here, of course. T-spine is the next 12 vertebrae. Then we have the lumbar spine below that. So that middle back there, often we're hunched over, a device, a computer, we're eating, whatever. We're kind of hunched forward a lot in our culture. Again, we've got to get that T-spine unlocked. And that stiffness means we're going to then get rid of that stiffness. That means that we're going to get mobility to the cervical and lumbar spine. It's going to really help us a lot with chronic pain of the spine especially. So again, mobilizing those stiff items I find more often than not in my practice really unlocks so much of the body. You'd be amazed. So mobilizing ankles, hips, T-spine, and then another big one, anterior shoulder. This part of our shoulder called anterior shoulder, the front of the shoulder, has a sandwich of the pec muscle, the deltoid, and the biceps. They all are sandwiched together and they get beat up and they get short and tight. Let's mobilize that. Let's open that up, okay? And then those areas can really lead to what's called almost like giving slack to other areas, okay? So don't be surprised if you have pain in like the knee and you start mobilizing ankles and hips, even though you may not have ankle and hip pain. Guess what? That knee's gonna start to feel better over time. Why? Because you're addressing it globally. You're looking at the factors beyond just the knee. And then you're gonna end up with some good wins there. What do we want to do? So what do you want to do as far as activating things that tend to be phasic or kind of off and not doing a whole lot? Our glutes, right? We sit on our butts a lot. And remember, I mentioned about those hip flexors. Well, when hip flexors are tight and short, our glutes don't fire. They don't turn on hardly at all. So we need to mobilize those, but mobilize hip first, and then you can access the glutes. The deep core. A lot of us focus on anterior core, which is the front of our abs there, the six pack or whatever. And we want to see more muscle definition. That's great and all, but our core wraps all the way around your entire back, okay? We have to work on our deep core. One of the best ways to do that is to take a deep breath and just blow the air out slowly. And as you do that, think about cinching up your waist and pulling your belly button in and kind of keeping attention throughout the day. That's big. Scapular retractors, we tend to spend a lot of time like this. We breathe like this. We're in stressful situations. We're driving through traffic and, people with road rage. And it's, we've got to get our shoulders down out of our ears and then pull them down. Okay, scapular retractors are our middle back muscles like rhomboid trapezius. We've got to get those activated because they oppose some of these tight muscles that are up like this and causing a lot of issues. If you have especially chronic neck pain or migraines, things up in here, got to get those scapular retractors fired up, okay? Now, if you start working on these things with the soft tissue movements we talked about earlier with the foam rolling massage gun and you're going at it gently, but you take a few months to do that. If you're really not seeing a lot happen and your body improve, definitely seek out professional advice. You got to be really careful with chronic pain. I definitely don't want you to make it any worse, but I'd like you to try some of these tools and see if you can make a little headway, okay? Try some gentle stretching. I'd be careful about things like yoga. It sounds like, oh man, let me get into some yoga. That looks amazing and very relaxing. It can be, but you got to start with beginner restorative yoga. Very, very entry level. You got to be very careful. I've restored a lot of people that do yoga for years, and they've got some issues just like the rest of us that they've got to work on. So let's talk about a couple stories that'll help you illustrate how powerful this holistic approach is if we really look at the body as a whole. I had a client who could not lift his arm above his shoulder, pretty much in that frozen shoulder type group there, right? He threw football, he played quarterback all the way through college for years, and he'd been to physical therapy for how long? 3 to 4 months. He's had other therapy, he's had doctors look at it, he considered surgery, and he was missing time with some of his kids because he wanted to continue to play like backyard and just hang out with kids and have fun, and his shoulder was killing him. When I assessed him, I found out that he actually had a lot of great musculature. So he was being treated by the PT clinic as if he was weak. All the muscle bellies were very robust and strong. You know what it was? There was a couple structures that were missed, they were not assessed. I call them the brakes of the shoulder. We had to unlock those. It did require manual therapy, but once I did that, I think it was maybe 8 to 10 sessions there. He got almost complete full 180-degree flexion of that shoulder. And this is years ago, and from what I hear, he's still doing really well today. It was a permanent fix because we didn't just look at the shoulder and do traditional PT. We looked at all the structures involved with that. So we talked about his breathing, his T-spine, scapular retractors, the stuff I talked to you about earlier. We addressed that. Another client was came to me, and he could not bend down and with his hands below about the knee level. He would get excruciating pain and oftentimes vomit. It was so bad, just instantly, just sometimes projectile vomit. I mean, it was just, imagine not knowing if you could bend down or not to pick something up or tie your shoes. It just completely controlled his whole life. He had actually opted already for surgery, which failed. It did almost nothing. He had a lot of medications he was taking, injections that almost all failed. You know what I did? I unlocked the muscle abilities I told you about. I helped him unlock those, okay, clinically, and I gave him homework to keep those moving. And what happened, the nerves are being trapped in there, especially his sciatic nerve. And once we unlocked those, it was like a whole different person. And I retested him on the same test as when he came in, and he got about 3 to 4 times improvement in range of motion from unlocking these muscle bellies, okay? So all these professionals had missed that. And again, am I knocking them? No, I'm saying there's a place for surgery, right? There's a place for injections. I'm just saying that didn't work for this individual. So what if we take a non-invasive approach, soft tissue approach, a neurological approach first, and consider that before going into those other options, which are always still available on the table for you. All right, so hopefully this helped you out. I know that's a huge topic. We could talk about it for hours, and there's so many individual things that you probably want to address, but I just wanted to at least give you some insight into chronic pain and what we can do about it. All right, I've written a really great ebook you can check out on my website called The Vibrant Health Breakthrough is the name of the ebook. Website is going to be drjasonnd.com. So Dr. Jason, ND is a naturopathic doctor.com. Hopefully you can check out that ebook and hopefully get something from it. It's just all pure content. I'm here to help you be well. Okay, until next time, you be good. Bye-bye.